Okay, this is Dr. Mcdougall on cancer, part number 5. We're going to be talking especially about prostate cancer. Okay, so this is Dr. Mcdougall from what he writes. And these are all from his videos and from his newsletters that are available on his website, drmcdougall.com, or his YouTube channel, Dr. Mcdougall Medical Health Center. Okay, so here we go. Prostatectomy surgery is removal of the prostate. Prostatectomy surgery often causes impotence. Prostatectomy surgery for prostate cancer is often unnecessary. In fact, in some studies, there was no significant difference between radical prostatectomy, watchful waiting, or all-cause mortality. So the patient who did nothing did as well as the ones who had this major surgery. In other words, why would you want to have your prostate surgically removed with all the potential side effects when the patients who had zero surgery did just as well in terms of survival? Okay, and I'm sure they did better in terms of pain, discomfort, and sexual potency. The watchful waiting group that had no surgery was able to follow its PSA, prostate-specific antigen. It's a blood test that's an indicator of whether or not the prostate cancer is growing. They had less impotence and urinary incontinence. Okay, there's the paper reference. Okay, Dr. Mcdougall, I tell my asymptomatic patients that they should not check their PSA. There is no survival benefit. By the way, I would not check my PSA. What I do is I live in such a way that my risk is very low. Because what the public tends to not understand is they don't understand the concept of false positive. The vast majority of screening tests primarily detect false positives. And it causes all this anxiety and workup and expense and sometimes overtreatment that, you want to avoid it. Okay, so Dr. Mcdougall, I tell my patients not to check their PSA. There is no survival benefit. With regard to those who've been diagnosed with prostate cancer, I recommend watchful waiting for all of them. Prostate cancer is more common in wealthy countries because they eat more animal foods, including dairy. Dairy is associated with prostate cancer big time. PSA is a high-risk test. If the PSA is significantly elevated, typically a prostate biopsy will be recommended. Microscopic prostate cancer is super common. The older the patient, the higher the risk that a random prostate biopsy will be positive for prostate cancer. So these are perfect examples of turtles, meaning that if you'd left them alone, they would have never caused you any problems. So you want to leave them alone. You don't want to go looking for these things because then you're like, oh my God, it's cancer. You get too worried and then you overtreat it and then you suffer the side effects of the treatment. Okay, in terms of these random biopsies, for men in their 20s, 8% would be positive if you just randomly biopsied them for cancer. For men in their 30s, they can know this from autopsy studies. For men in their 30s, 30% of prostate biopsies are positive. For men in their 50s, 50% of their biopsies are positive. So what I'm saying is you don't always want to know. To say you want to know is a very ignorant statement because you have to think about it. Do you really think a treatment's going to make any difference? Do you think getting a treatment or knowing early will be of any benefit to you? And, a lot of people, for some people, I guess they have no self-discipline and they can't get themselves to live and eat healthy unless they have a diagnosis. But, man, a lot of other stuff's going to come with it. There's going to be all this pressure. You're going to have a lot of pressure to, get that biopsy and get the prostatectomy. It's better to just be healthy and not know. That's what I do. Okay, for men in their 70s, 80% of prostate biopsies would be positive for cancer. In other words, lots of men have small asymptomatic prostate cancers that will never cause any symptoms. It is better to not know about these. Prostate biopsy consists of 12 needle specimens. So you got upper quadrants or sextants, upper sextant right and left, middle sextant right and left, lower sextant right and left. So that's 12 specimens, let's say with an 18 gauge core needle. It's a lot of tissue you're ripping out of your prostate, and you got these nerves related to erectile function going through there. I would not want that. He continues, 55% of men experience pain with prostate biopsies. Some men become impotent just from the prostate biopsy. About 41% of them temporarily. Then after 6 months, about 15% will still be impotent. So you could become impotent just from a biopsy. Infection is the most common complication of prostate biopsy because it's a transrectal biopsy. Fluoroquinolone-resistant E. coli rates of infectious complications range from 0.1 to 7%. And fluoroquinolones are kind of a brutal antibiotic. I gave a lecture about that before. They've got fluoride on them. They cross the blood-brain barrier. They can cause seizures. They can cause a lot of symptoms. They can cause other problems too. You don't want to take those antibiotics if you don't have to. Sepsis rates range from 0.3 to 3.1%, depending on the antibiotic prophylaxis regime. Here's a bunch of references on all these articles, Dr. Mcdougall newsletters on prostate cancer, including, a whole bunch of them. Testosterone supplements in men cause increased risk of heart disease. Okay. Vaginal estrogen therapy appears to be safe in women with breast cancer because it's a local therapy. Okay. A lot of women ask about that. So there it is. Vaginal estrogen therapy appears safe in women with breast cancer. He's got the reference here from JAMA. Okay, it says Western diet causes earlier onset of puberty before girls are emotionally ready for that. Bovine leukemia virus is very common in dairy herds, and it's common in beef herds, as much as 38% of the cattle. Bovine leukemia virus is very similar to human T-cell leukemia lymphoma virus. The more cow protein that people ate, the higher their risk of a death from lymphoma. Bovine leukemia virus seems associated with increased risk of breast cancer in humans. Okay, so that's interesting stuff. Okay, you know what? I think we'll end it here because we're going to start getting into a different topic with this second part. So I hope that was helpful.